Hi, I'm Dr. Steve Myers, and I'm here with my patient Chris, who has a long-standing history of arthritis issues. He is about 3 months out from a stem cell procedure for treating both of his hips, his left knee and his left elbow. He has a long-standing history of some arthritis issues with his left hip, dating back to an injury in college. He's already had surgery on his left hip and a left ACL injury repaired surgically as well. Before we talk to him, we're going to take a quick look at his imaging studies. Okay, so taking a look at his pelvis, this is the right hip, and this is his more symptomatic left hip. If we zoom in here on his left hip, you can see that he has notable loss of space between the bones. The ball and the cup space here is diminished. He has good space in this section of the joint, but this area here, he has some pretty notable loss of joint space in the hip joint. Looking at the other view of his hip, this is the view with his hip turned out to the side. You can see that he has, again, notable loss of space at the top of the joint here. This loss of dark space is loss of cartilage. We call that arthritis. He also has a big bone spur here and multiple bone spurs off the femoral head here, and again, right here as well. Bone spurs are part of arthritis. Looking at his knee joint, this is a staining x-ray looking at both of his knees. This is his left knee where he has had an ACL reconstruction. Zooming in, you can see the metal component in his knee joint where the ACL replacement was secured. Also, he has a little bit of loss of joint space on the inside and a developing bone spur on the inside of his left femur. The bone spur and the mild loss of joint space indicates some arthritis in his left knee. Okay, so thinking back to before procedure, more than 3 months ago, describe the issues, particularly with your left hip. What kind of difficulty were you having with the hip? And what kind of activities were especially difficult?
I actually was having issues walking. I walk with a limp. I've walked with a limp for probably a decade. Before and after my hip resurfacing that was done about 3 years ago. Since I'd had that resurfacing, I'd taken jiu-jitsu back up, and that had severely complicated my problems, and quite frankly, before I came in, I was considering having a hip replacement. My joint was that deteriorated. I was in severe pain. I haven't slept a night without pain in over a decade. I've had severe pain in that hip.
And you're also having some issues with the knee and the elbow as well. Describe those.
I work out a lot, and I think just probably overuse injuries. The knee, obviously, I've had a couple surgeries on that, and just old issues that continue to flare up, probably stemming from the issues that I was having in my hip. But it was starting to have pain off and on in those joints as well.
So here we are 3 months post-procedure. How are things going with the joints?
Better than I had expected. I wasn't quite sure what to expect. I had seen other testimonials and done quite a bit of research. This was, like I mentioned, this was probably my last stop before having a hip replacement on my left hip, and I just wanted to try something prior to, once you do the hip replacement, you can't go back. So I will tell you, my experience was about day 4 after the procedure, it was like the pain switch was turned off. And that's when I realized how much pain I'd actually been living through. And I know probably at that point it was probably due to the anti-inflammatory nature of the stem cell treatment itself, not a regeneration of cartilage, but I remember my first night of pain-free sleep. It was like the switch had been shut off. Even taking pain medication had not done it to that extent. Are
there activities that you can do now that you could not do before?
I haven't pushed the envelope, but what I would have never been able to run, and I know I'm not supposed to run, but I coach my kids' soccer teams, and last Saturday I was out for an hour and a half running around cutting and jumping and kicking balls and playing with the kids, and I would have never been able to do that a year ago.
And how's sleep?
Still pain-free. Amazingly, still pain-free.
So here we are 3 months post-procedure. Overall, considering your all four joints, 50, 60, 80, 95% better, try to put a number on it.
I'd say 85% at this point.
Very good. And having been through stem cell procedure, do you feel like you made the right decision with your treatment?
I do, absolutely. I'd do it again.
Very good. Well, thanks so much for coming in and sharing your experience.
Thank you. Appreciate your help.